Imagine going for a simple health check and discovering a quiet revolution in prostate cancer screening, something that could save millions of lives.
This revolution isn't widely known. In fact, most doctors haven't even heard about the breakthrough I'm about to explain.
But first, let's understand the tool nearly every man knows, the PSA test. A test that's useful, but deeply flawed.
Many people think PSA detects cancer, but it only measures prostate activity, not cancer itself.
PSA goes up for countless reasons. Inflammation, infection, enlargement, even intense exercise like cycling.
PSA can rise from cancer or harmless causes, so it's more of a warning than a diagnosis.
Because of this, many men end up in unnecessary MRIs and biopsies, worrying for weeks about test results that turn out perfectly normal.
Now imagine a test that detects cancer's unique chemical fingerprints, something far more precise than PSA could ever be.
That test is the PSE, the Prostate Screening Epigenetic Test, a major breakthrough in early cancer detection.
Instead of measuring proteins in your blood, the PSE test looks at changes on your DNA, called epigenetic markers.
Think of your DNA as a book. The letters never change, but cancer leaves sticky notes on the pages.
These epigenetic markers act like notes that tell your genes how to read their instructions.
Cancer leaves a very specific pattern of notes, and the PSE test is trained to find 5 of them with high precision.
This means the PSE test doesn't just ask if the prostate is active, it asks whether cancer has left its signature. Early research shows that combining PSA with PSE boosts detection accuracy to around 94%.
That level of accuracy can dramatically reduce unnecessary biopsies and catch dangerous cancers earlier. It's not just an upgrade, it's a transformation in how we approach prostate cancer screening.
To help you understand the impact, let me share the story of 2 brothers, based on real patients I've treated.
Tom and Harry were identical twins, same lifestyle, same habits, same age, and both took PSA tests. Tom's PSA came back slightly elevated. He looked healthy, but was immediately anxious. Following guidelines, Tom went for an MRI. The results were unclear, so a biopsy was recommended.
For 3 long weeks, Tom feared the worst. He couldn't sleep and withdrew from his normal routines. But when the biopsy results arrived, they showed no cancer, only inflammation.
Months later, his twin brother Harry came in with the same elevated PSA level.
This time, I had access to the PSE test. Harry agreed to take it.
The PSE test found no cancer-specific markers, giving us high confidence he was safe.
Harry avoided the MRI, the biopsy, and, most importantly, the weeks of fear his brother endured.
Same PSA result. 2 completely different experiences. That's the difference precision makes.
Stories like this remind me that better screening doesn't just save lives. It protects peace of mind. Now, I want to be transparent. The PSE test isn't perfect. No medical test is.
Its research is early, and large-scale global studies are still needed.
Result did he apply for?
It's also not available everywhere yet, and the cost, around £750, makes it less accessible.
But nearly all medical innovations begin this way: expensive, limited, and slowly expanding. Over time, as testing scales and demand goes, accessibility improves.
Think about MRIs. They were once rare and costly. Now they're available worldwide. I believe epigenetic testing will follow a similar path, becoming a central part of cancer screening.
And honestly, the science behind it is incredibly solid. More direct, more logical, more precise.
But until this test becomes mainstream, men still need to use PSA wisely.
PSA is not useless. It still saves lives by detecting warning signs early.
So what should men do right now? First, don't ignore screening. Early detection changes outcomes.
Second, know your risk factors: age, family history, race, and chronic inflammation.
African and Caribbean men, and men with a parent or brother affected, face higher risks.
Third, pay attention to changes in urinary habits. Small symptoms can be early signals.
Fourth, talk openly with your doctor. Silence has cost many men precious time.
Fifth, consider advanced tests like PSA or genetic markers if available.
If you can't access PSA, options like PHI, 4K score, and PCA3 still offer better clarity than PSA alone.
Knowledge gives you power, and choosing screening gives you control.
Screening is not about fear. It's about staying ahead of disease before symptoms appear.
And now, let me share a second story, a reminder of why screening matters so much.
Michael was a 63-year-old teacher who avoided PSA testing for years.
He told me he didn't want unnecessary procedures or the anxiety of false alarms.
For a long time, he felt perfectly fine until subtle symptoms finally appeared.
When we performed his first scan, the cancer had already spread beyond the prostate.
I still remember the shock in his eyes, a mixture of regret, fear, and disbelief.
He said, "Doctor, I wish I had come sooner." Those words never leave you.
If a test like PSE had existed earlier, maybe he would have agreed to screen sooner.
His story is why I fight so hard to help men understand the importance of early detection.
Fear of testing kills far more men than the tests themselves.
Screening isn't just medical. It's emotional, it's protective, and it's empowering.
So where does the PSE test fit into the future of prostate cancer detection?
It represents a shift from indirect measurements to direct biological signatures.
It could dramatically decrease unnecessary biopsies, saving men from painful procedures.
It may identify aggressive cancers earlier, when treatment is most effective.
And it has the potential to remove the guesswork PSA often creates.
Within a decade, tests like PSE may become the global standard. For now, it offers a glimpse of what medicine can achieve when we read cancer's fingerprints.
Better tools mean better outcomes. Better outcomes mean longer, healthier lives.
Whether you're screened with PSA, PSE, or both, the most important step is taking action.
If you're a man over 45, or you care about someone who is, please don't wait.
Have the conversation. Ask about screening.
Yeah.
Discuss your risks early.
Prostate cancer is highly treatable when caught early, but devastating when found late.
This new PSE test is a powerful step toward a future with fewer late diagnoses.
Share this message. It might save a life, and that life could be someone you love.
If you found this video valuable, subscribe to Nourish Today for life-changing health insights every week.
Thank you for watching. Your support helps us share vital health knowledge with families everywhere.
Hit subscribe, tap the bell, and join the Nourish Today community. Your health journey deserves clarity and confidence.